Welcome to our virtual workshop on protecting COVID-19 response workers. During prior infectious disease outbreaks, the worker training program has enhanced safety and health training for emergency responders, healthcare workers, correctional facilities, sanitation, transportation, mortuary, teachers, and other workers to ensure that responders are aware of site-specific hazards and mitigation techniques prior to and during response activities. The worker training program will continue to closely coordinate across HHS and the United States government, as well as with state, local, tribal, and territorial and private sector partners to ensure that our activities, which have been funded through the Corona Preparedness and Response Supplemental Appropriations Act of 2020, are complementary across programs, considering the evolving factors associated with coronavirus exposure and supporting the highest priority response activities to protect the health of COVID-19 responders.
SARS-CoV-2 is the virus that causes COVID-19 disease. Most people who come in contact with a COVID-19 patient won't get sick. So that's the good news. The bad news, that the ill population is going to double just about every generation. So this is why it's so important that we practice good infection control. How does the virus enter your body? It enters your body through your mucous membranes, like your eyes, nose, and your mouth. Your skin is actually an excellent barrier. So unless you are touching your eyes, nose, and mouth, you're not going to be having it come in your body unless you are next to someone who has the virus and they are coughing and releasing respiratory droplets that are invasive. So primarily, we think SARS-CoV-2, according to current data, is spread by someone coughing, those respiratory droplets flying through the air, and then landing in the mouth or in the nose of someone who's nearby, or having someone cough, getting those infected droplets on their hand, transferring that to a nearby surface, then having someone else touch that surface and infect themselves by touching their mouth, nose, or eyes.
There's a recent study showing the COVID-19 virus is present in viable and nasal and throat swabs and sputum samples. And it's viable as symptoms are developing from day 1 through 7 of infection. Actually, this study demonstrated this was a study with people who had mild infections, that they were shedding fairly high quantities of virus even starting at day 1, which might explain why there is asymptomatic transmission of this, or what appears to be asymptomatic transmission of this organism.
You indeed may be the people who most matter in this real fight. The front lines of defense are the people that matter. And you're seeing that play out in your cities, your communities throughout the nation. The social distancing, you're being the front lines of defense, you being supporting our workers, our communities who are indeed the front lines of defense.
The main issue that we're seeing on the ground right now is lack of access to personal protective equipment, lack of updated training, communities' lack of awareness to risk, language access barriers, equitable access to information, and the policies that right now that are marginalizing many of the communities that are represented by our partners.
We know that PPE isn't intuitive. We know that people make dangerous errors every day in their basic use of PPE. This culture that exists within our healthcare systems needs to be changed to focus more on safety.
These points on this slide are really the core of the worker training program. From what I've seen and how I've participated with you all as my colleagues in this worker training program at the NIHS, we provide the necessary education and training of the workforce to provide for their safety while they do these critical jobs that they need to do to keep our communities running. The education and training that we provide informs policies and procedures in the workplace, which again are critically important to conducting the business that encompasses the critical functions They also, through the development of these policies and procedures, we're informed about what special equipment might be needed, what competencies and what proficiencies are required to do our job safely. And all of this informs a concept of operations that we can work together to achieve a workforce that has that education and training, those policies and procedures, that safety equipment, those proficiencies to do their job well, do it safely.
We need to recognize that planning is local. Local health departments and local emergency responders are so essential to community preparedness, looking at the planning and proper training throughout their community assets. We need to look at risk assessment and situational awareness, different scenarios, how intense they are, the severity of them, and what's the impact of all the situations that is ongoing in the community. Obviously, something that's of vital importance to all of us as part of the WTP community is responder safety and health. So identifying the responder safety and health risks, which throughout the day have been so well addressed and identified, what is the support that the responders have? How do we provide the training for them? And looking at monitoring responder safety and health during and after incident responses. This is when the planning process is so important that we don't just leave them on the shelf, and that people are actively involved with reviewing their plans and ensuring that the processes are in place, are effective to keep our responders safe and healthy during emergencies.
So our world, as far as firefighters and first responders, we are always in an uncontrolled environment. We don't have the luxury of being in a hospital setting, sometimes even in a physical building. We could be in the middle of the road. We can be in a hoarder's house. We could be in an apartment complex. We could be in a multi-million-dollar mansion. You just never know. And we have no idea how many people are going to be there when we get there. Our biggest thing is for our folks to, hey, let's remember what we're doing today. Review your department's exposure control plan. So let's think about what's that plan and what are you doing day to day to take a risk-based response to where you are. And for us, with this COVID-19, we had to look at nationally adjusting just even from the callers when they call in and say, hey, I have an emergency in my house, and the dispatcher gets information, they may dispatch us for a broken leg or somebody having something else. But we've actually had to work nationally to make sure additional questions were added into their protocols to assess whether or not we're going into a potential exposure to COVID.
Stress is a normal part of our daily lives, and in normal doses, it's a motivating factor. It gets us out of bed, it gets us active, keeps us in shape. But when the situation becomes overwhelming, it can be damaging if we are not monitoring it properly.
Regarding personal stress management strategies, there are 2 or 3. One is that we can never forget basic self-care. And what I mean by that is maintaining and attending to physiology, and that is the body. Another kind of core strategy, really any kind of crisis and just ongoing human life to be healthy, is about maintaining and initiating social and emotional connection. Final main personal stress management strategy has to do with stimulus control and to regulate mood and well-being. And all I mean by that is what you expose yourself to impacts your mood and well-being. For the long haul, building resilience, one is just to make a commitment to basic self-care, to social connection, to stimulus control. It's good to acknowledge that there are many things we can't control. We are only promised and can deal with one day at a time. And then finally, looking for opportunities for meaning and reframing.
But indeed, in our future, after COVID-19 and we get through this, there will be names that will arise that we have never, ever heard of and diseases we have never, ever heard of before. And we had all heard about, at least in medicine and from a clinical perspective, of course we'd heard of coronavirus, common cold, but we had never heard of COVID-19 and the havoc that's reaching across the world. We had never heard of that before. So it is a predictable surprise that COVID-19 has happened, and it is a predictable surprise that in our future, other names will arise with similar kinds of real threats to our world.
Never more than ever do we need this network of NIEHS trainers that can be expanded with all the skills, basic skills, a real muscle memory so that they can jump into action, not only in this pandemic and in the future. And what I'd like to see happen as we, go out and try to reach all the at-risk workers is that we talk to them about what we do after the pandemic. Much to this point of the complacency and the disengagement that we see in our, various constituencies after the crisis is over. And so this is something I think we should be building into our training now. After the pandemic, what should we leave in place? I look forward to talking to all of you about how we do that so that we will have our network that can be deployed with the flexibility in the next crisis when every other system sort of is at a loss on how to respond. Thanks to NIEHS for, creating this kind of unique network of academics, industrial hygiene professionals, physicians, emergency response personnel. We have our work cut out for us and some opportunities now to work on not only building in this muscle memory for training and getting people ready to respond, but also in building greater collaborations for technology as well as training.